pituitary neuroendocrine tumors that arise within our pituitary gland. It's a little gland, which is the size of a pea, that sits on the underside of the brain. There are 3 reasons that a pituitary adenoma needs to be removed. If they're producing hormones, if they're large enough to be causing trouble from the start, or if they're growing over time. Our pituitary gland is the control central for all the hormones in the body. Some of these tumors that arise from these glands still remember how to produce hormones, but they don't obey the rules or regulations of the body anymore. They sort of go awry. This can come in the form of excess steroids, what we call Cushing's disease. They can produce excess growth hormone, a condition called acromegaly, or they can produce more of that hormone called prolactin. That's the hormone that allows us to produce milk. So if they produce more of the hormones that are required in the body, that can cause a lot of trouble to the point where it can become life-threatening. That's a reason for us to remove them. The other reason is if it's large enough that it's pushing on things that is causing trouble. Usually the main thing that they cause is vision loss. And over time, if we find them to be growing, then we don't want them to grow too much before we remove them. And that's the third reason to remove them. There's one particular tumor called prolactinomas that can be treated with medication. But the majority of the other tumors are treated surgically with endoscopic surgery or surgery through the nose. UPMC has been a pioneer in endoscopic pituitary surgery. We had an extremely high volume of cases, but beyond that, a lot of these techniques were developed here with ENT surgeons and neurosurgeons working side by side. By working again as a team, we're able to be much more effective in removing every last little cell of these tumors. Our goal is always to separate the patient from the disease in a way that is not going to be a problem again.